Hi, today we are going to see some common bedside trap in Osce exam. So, first trap is a reading glass or a hearing aid. If you see a reading glass or a hearing aid, then you have to ask patient like this. I can see that you have a glass or a hearing aid. Are they yours? Would you like to use it during this assessment? If suppose the patient say yes, let me help you in putting this on. Can you see or hear better now? Or if the patient says no, then you have to say like, alright, when do you use it? Okay, I will take a note of that. Okay, so coming to the next common trap, that is trap number 2, cigarette sticks or lighters. So you have to speak like this. I can see that you have a cigarette or a lighter beside your table. Are they yours? So if patient says like yes, so then you have to, how long have you been smoking? Do you have any plans to quit? If suppose patient says yes, so I can provide you leaflets regarding quitting smoking after a little chat. And when you are ready, I'll be happy to make referral to the smoking cessation team for you. So if suppose the patient says like no, then you need to ask like, can I offer you some nicotine patch or gum to help you instead? Still the patient is not allowing, then you need to give some advice like this. See, Mr. Smith, this hospital is a non-smoking facility and we are surrounded by piped oxygen and other equipment which are highly combustible and may still fire in presence of smoke. So I'm afraid I have to take this away and keep it locked in a safe place or give it to your relative to take away when they come to visit. Okay? And what you have to do? Physically remove the cigarettes from the room and put it in the assessor's table, assuming that it is ward covered. Okay. So let's see the next trap, that is trap number 3, that is glass of water, and if you see a nil by mouth board on patient's bedside. So you have to say like this. I can see that you have a glass of water here. Has anyone advised you your diet status, that like if you are nil by mouth or something like that? If the patient says no, then you need to say okay. After this assessment, I will check your diet status on the chart and inform you of this as soon as I can. Is that all right? So in the meantime, may I ask you not to eat or drink until I get the information? Is it okay? Okay. So if suppose a patient is being prepared for a surgery, like a pre-op, then you have to verbalize like this. As a part of your pre-operative preparation, you are advised not to eat or drink for a certain number of hours so that your risk of aspiration during the procedure will be greatly reduced. So let me just check on your chart when this should commence, and I'll inform you of this as soon as I can after this assessment. Okay. So this is how you need to do address this trap, like a glass of water or sugary nil by mouth board. This is a common trap. So coming to the next trap, that is trap number 4, that is a specimen cup or a sputum mug. If you see, then you have to say like this. I can see that you have a specimen cup in here. Do you know what to do with it? If the patient says no, then like, okay, I will check on your chart. If you need to collect any specimen, and I'll get back to you after this assessment. If there is a sputum mark, then you need to ask like this: are you able to expectorate? We may need to collect a sputum sample for analysis. So please let me know if already have the sample so I can send it to the pathology. And I can assist you in doing deep breathing and coughing exercise after this assessment. If it's alright with you, I can also refer you to a chest physiotherapist to aid in the mobilization of your secretions. Alright. Okay, coming to the next most common trap is the trap number 5, which include the mobility devices. So this may include a walking stick or a crutch or a Zimmer frame. So if you see any of these in the bedside, then you have to ask like this: is this walking stick yours? How long you have been using it? Are you steady on your feet? I can make a referral to you to the physiotherapist to assist you in using this device. Would you like me to do that? On which side would you like me to place your mobility device? Okay, so you just say this to the patient, and you can keep the walking stick on some side during the assessment, and you can keep it back. Right. You need to address all these traps. So the next common trap, that is the trap number 5, is inhaler or a spacing device, phaser device. So if you see any of these inhalers, so you have to say like this: is this inhaler yours, or when do you use it? How long have you been using it? So are you confident in using this, or do you have any concern regarding your inhaler? Okay, if you see these type of inhalers, so you can help the patient with giving some informations, and you can also ask them like, do you have any other concern before we are proceeding to our observations. So I've just discussed the most common trap which is has to be addressed in the Osce examination. Hope you are clear with this trap, and I'm sure you'll address this trap in the examination. Thank you.